corneal ulcers, and we're going to look at the types of the corneal ulcers. So to ask a few questions, what is the bacterial corneal ulcer, and what are the risk factors as well as the clinical features of the bacterial corneal ulcers? Next is what is the viral corneal ulcer and the risk factors and the clinical features. Last question will be what is the parasitic corneal ulcers, and same thing, the risk factors and the clinical features. So we'll find these answers in this video. So first one is the bacterial corneal ulcer. So in case of bacterial corneal ulcer, the risk factors, it includes, there is the contact lens wear. Next, there is a trauma as well. Then the chronic steroid use. Next, there is also the anesthetic cornea, as well as presence of the dry eye and the exposure keratopathy. So now we move on to the clinical features. So the clinical features in case of bacterial, there is the hypopion. So the hypopion, so this is nothing but there is fluid as well as it is mobile. So next we look at the other clinical feature, that is the Pseudomonas aeruginosa. So Pseudomonas aeruginosa, it is likely to have a rapid course. So this has a rapid course with the deep corneal necrosis. So this is associated with the deep corneal necrosis. Next, we move on to the fungal. So in case of fungal, the risk factors, it includes the presence of the vegetative matter. Next, what are the clinical features of this fungal? So the clinical features is that there is less pain. There is less pain and watering. Less pain and watering compared to the extent of vision loss and signs. So there is less pain and watering compared to the extent of vision loss and signs. Then other thing to note is that in case of the fungal corneal ulcer, it tends to be indolent. It tends to be indolent but progressive. Other thing to note is that the hypopion, it is thick. It is thick as well as it is immobile. Next we move on to the viral. So in case of viral, the risk factors is that it is low immunity, as well as in case of recurrent attacks. So here the clinical features includes, there is increase in pain. There is increase in the pain, that is there is more pain compared to the others, and there is also increase in the watering. So there is increase in watering and there is more pain compared to the vision loss. Compared to the vision loss, this is more, that is increase in pain and increase in watering. Then there is also recurrence. Recurrences are characteristics of this feature. So we saw the bacterial, fungal, viral. Next we will look at the parasitic. So what is the parasitic? Parasitic is risk factors include contact lens wear. Then in cases of the exposure to the contaminated water, that is the acanth amoeba. Next is we look at the clinical features. That is, there is a disproportionately severe pain. So there is very severe pain. So the most pain is seen in the parasitic, that is very severe pain, and there is indolent course. So there is indolent course and initial stages are often mistaken to be viral and fungal. So initially it can be mistaken as the viral or the fungal, but it is actually the parasitic. So they can be diagnosing will be a challenge in this case. So now just answering the questions what we had asked. So firstly we had asked what is bacterial. So if you look at bacterial, it is nothing but the contact lens wear. So contact lens wear, these are all the risk factors. So in case of contact lens wear, there is trauma, chronic steroid use, there is anesthetic, cornea, as well as presence of dry eye. There is also exposure, keratopathy. So these are all the risk factors correlated to the bacterial. Then looking at the clinical features, it includes there is hypopion. So the hypopion, if you see, there is presence of fluid as well as it is mobile. And other thing to note is that the Pseudomonas aeruginosa, so this has a rapid course and it has a deep corneal necrosis as well. The next we asked was what is a viral corneal ulcer. So in case of the viral corneal ulcer, so here the risk factors being there is low immunity as well as in case of the recurrent attacks. So what are the clinical features here? Clinical features here, it includes there is more pain, there is increase in the pain and watering. So there is increase in pain and watering compared to the extent of the vision loss and signs. So it's significantly higher compared to the vision loss. And there is also high severity of recurrence. Next we asked is about parasitic. So what is parasitic? Parasitic, the risk factors is mainly in case of the contact lens wear. And there is exposure to the contaminated water. Also, there is exposure to the contaminated water. That is the acanth amoeba. So next, we will look at the treatment, the clinical features. So the clinical features, as we saw, there was very severe pain. And it can also be the indolent course. It has an indolent course. And in initial stages, it is mistaken to be the fungal or the viral. So it is always a challenge to diagnose the parasitic corneal ulcer.